Well, trouble with varicose, or trouble with veins, I should say, could cause pain, but it could also lead to a life-threatening infection if left untreated. With me right now, cardiologist Dr. Tom Eagan from Brookwood Baptist to talk about varicose veins. We were just kind of chatting in the commercial break. Obviously, a lot of people know what those are, but for those who don't, kind of explain what varicose veins are.
Well, varicose veins are veins in the lower extremity where the veins are dilated, they're big, and they may cause symptoms such as pain, swelling, numbness, tingling. They're usually associated with problems in the venous system when you begin to see large dilated veins of the lower extremity. So that may imply there's something going on, something wrong with your venous system of your lower extremity.
Are there any groups of people in particular that are more at risk for having this condition?
Well, varicose veins are the most common cause is genetic. It's family history. There are certainly occupational causes such as prolonged standing, sitting. We see it in, say, truck drivers, mailmen, those types of occupations. So they're occupational hazards. It also is seen more commonly in women because of pregnancy. And then, of course, certainly with demographics and aging of the population.
Right. And now, is there anything you can do, like you mentioned, a group of people, and of course, if it's a genetic thing, anything you can do to kind of prevent them from forming?
Well, a few things you can do. Number one is walking. Exercise really helps to improve the circulation, lessen the risk from varicose veins. Also, stockings, compression stockings, wearing compression to compress those veins to get that blood to circulate, not pool in your lower extremity. And if you have an occupation like such as we're doing now, sitting, you need to get up and walk for a few minutes and get that blood to circulate.
Now, if it gets to a point where you can't start walking or exercise more, wear the compression stockings, and you have to seek treatment, what are the treatment options?
Well, there are a number of really good treatments now that are very, very successful with low complication rates that are minimally invasive type procedures where these varicose veins are abnormal. They're really no good to you at that point, and they need to be taken out or closed, and they can be done with minimally invasive procedures with very, very high success rate and low complications.
So we talked about kind of things you can do at home to prevent them or to treat them, obviously in hospital, in the doctor's office, treatment options, but if you just don't treat them at all, what risks do you run by just ignoring them altogether?
Right, this is a very good question, Kelsey. So if you leave these varicose veins alone and we don't treat them, we don't take care of them with walking and compression stockings, over time, the venous insufficiency, the pooling of the blood will get worse. It can then lead to severe symptoms of pain, swelling, numbness, also dermatitis, skin changes, ultimately to ulceration and infections, which could be life-threatening.
So really just take care of them if you start to see that problem develop.
Absolutely.
People watching at home, if they maybe think they might have this problem, or if they think they're prone to this problem, who can they contact to get more information, and especially information on those treatment options you mentioned?
Well, certainly have to start with their own health care provider, and that health care provider can push them towards a venous specialist who may be knowledgeable in these newer techniques to treat these, these varicose veins.
All right, thank you.